Hi, this is Dr. Bob Danhofer, Public Health Officer from Douglas County. We had a lot of concern and question about COVID in schools this week and COVID in kids. So we're going to do it in a special short Facebook so that we can tell you about those issues. So we've got a couple of questions here. The first question is, what symptoms do kids have with COVID? Are they different from adults? So in general, the symptoms are about the same. Kids with COVID tend to have fever, cough, runny nose, sore throat. Now, kids don't usually get short of breath. Kids don't usually get a loss of sense of smell or taste. So it really looks like many other illnesses out there. Kids don't usually get very sick, but if your kid has fever and a cough, I'd encourage you to see their doctor and get tested for COVID. I've done a couple of them. They're relatively easy tests, and you can get us a result. Now, they're not 100% accurate. So even if the test shows that your kid does not have COVID, they should still stay home until all the symptoms are gone plus one more day. So because the COVID test is negative doesn't mean that's not COVID. It suggests it's not COVID. They should still stay home until they're all well and one day more. The second question is, why do we consider one case of COVID an outbreak when we don't do the same for like strep or mono? Well, you know, strep and mono tend to be much less severe diseases that spread a lot less. And at least for strep, we've got a really good test and a really good treatment for it. So we don't worry as much about strep or mono. Kids don't get admitted to the hospital. Their grandparents don't die of strep. But they do die of COVID, and that's why we really want to be careful about COVID in the schools, and we consider even a single case an outbreak. Now, we've had a couple of outbreaks in schools, but we don't think there's been much spread at schools. We've tested the other kids in the school, and we've tested those around, and it doesn't seem that they've spread it at school, so that's the good news. The third question is, what is quarantine? Is it for the entire household, and for how long? And so the story with quarantine is that with quarantine, the person who was exposed should be quarantined, but the other people in the family don't need to be exposed, don't need to be quarantined unless they were exposed. So let's say my teenager was exposed at school and gets this. They should kind of be in their room for a week, meals delivered to the door. They should be in the bathroom by themselves, and they should basically stay in their room for 2 weeks, and that would be ideal quarantine. The rest of the family can carry on as usual. Obviously, if my son then would get sick, then there's something more to do. But if they stay well, and the overwhelming majority of kids who are exposed will stay well, after 2 weeks, they're good to go. So what's a cohort exactly, and what are schools doing to keep kids safe? So schools are doing lots. They're working on hand washing, distancing, the use of masks. A cohort is a group of kids that your kid has been around for an extended period of time. So let's say your kid is in the 3rd grade class. All of those kids in the class have been with them for an extended period of time. And if one of those kids in the cohort is sick, they should then all be quarantined. And, you know, it gets so impossible for us to figure out in 3rd grade just what the exposure was in the class. And we consider that everybody that was in the classroom, everybody that shared the bus with them, is a cohort, and they should all be quarantined. What should happen is we shouldn't mix cohorts. So your 3rd grade class should not be mixed to the other 3rd grade class. And so that if one kid in 3rd grade class, just that class needs to be quarantined, not the kids who were in the other room and had no contact. And so does a negative test mean my kid can go back to school before quarantine is done? Unfortunately not. Now, a negative test is always a good thing, but during the 14 days of quarantine, you could become positive during any of those 14 days. So a test at any one of the days during quarantine could either be too early or too late. And so a negative test doesn't get you out of quarantine, unfortunately. People would love to do that. Now, we've gotten some conflicting information from the White House that use quarantine really incorrectly. And the other question is, does my kid need another test to be negative before they return to school? Absolutely not. If kids who are positive after 10 days, they're no longer contagious and they can go back into society. So another test is not needed to return to school. Hopefully that answers most of the questions, but I'm sure there'll be more. We'll be doing another Facebook Live this Friday night at 6 o'clock, so send us your questions then if you have more questions. Again, this is Dr. Bob Danhofer, the Public Health Officer in Douglas County. Thank you.